My name is Toby Gilbert. I normally work at the acute medical unit here at the Royal Adelaide Hospital. However, for the last several weeks, we have been piloting a new project called the Early Physician Interaction Initiative, or EPI. The goal of EPI was to see whether getting patients to contact a physician earlier in their stay, earlier in their hospital journey, might improve outcomes. For instance, we hope that we might be able to turn patients around from the emergency department, and instead of admitting them to hospital for several days, be able to provide good treatment outside of this hospital, and thereby not exposing patients to things like infection in the hospital and deconditioning that we know can happen. So I have spent 7 shifts so far down in the emergency department. I've seen about 50 patients across those 7 shifts, and these are all patients who were going to be admitted at least for one night, and probably several of them for many more nights. And about a quarter of them we found actually didn't need to be in hospital, and we found other ways of treating them. This is better for those patients to have treatment provided for them in their own homes. It's also much better for resources, so that hospital beds can be used for people who really need them, and that in turn will do things like reduce the amount of time patients coming in have to spend on the ED ramp. This initiative grew out of the work around preventing ramping, and we're in collaboration with the geriatric doctors, who are also having a presence in the emergency department to see if seeing older patients might improve their journey as well. For instance, one of the patients that I saw was living at home with her son who had a disability, and her son used to have carers come in, but the lady herself was becoming cognitively impaired, and although she had presented with flu-like symptoms and a temperature, the medical resident wanted to admit them so that the patient could see a social worker and an occupational therapist. So while we're in the emergency department, we picked up the phone to the GP, who said that he had already tried to get some of these services in place, and he was in the process of managing that, and that we shouldn't worry about that, especially given that she was the carer for his son. Admitting her to hospital wasn't the best thing to do. At that stage, we were left with a lady who had some flu. She looked actually quite okay. We lined up that she could see her GP in a couple of days if she wasn't feeling any better, and she managed to get home.